want you to see from this depiction is picture a donut, this purple thing, on a plate, this blue thing. And this is the donut hole in the middle. Now, the purple donut is all the stuff that physical therapists do that's neither refuted nor supported by strong evidence. Okay? It's a lot. This rim is the stuff that physical therapists do that's not supported by good evidence, but there's still some PTs who do it. And the donut hole is the stuff that PTs do that's supported by good evidence. And a lot of times the people in here judge the people in here, and I always say that makes them a D-hole, right? Because everything that I taught you today and yesterday is in the donut. It's not supported or refuted by good evidence. In your clinical practice, you'll have a chance to test it out. But I want to tell a story. Even though my practice has been in the donut, I myself was a D-hole at one point. I had a patient, when I was taking care of those Olympic athletes, I had a female wrestler who was a world gold medalist and the favorite to win the gold medal in Greece that year. And she had endometriosis, and it was so bad that sometimes she struggled to stand up straight. And at one point she walked into my office and she said, Major Bear, just going to let you know I'm going to have that surgery. And I wasn't really tracking this because I was sports medicine guy at the time. And I'm like, one of these athletes has surgery, it's a big deal. And I said, okay, what surgery? And she basically was going to have a hysterectomy at 27. And I'm like, hold on. A few months, this is how God works. A few months prior to that, I had met a therapist at a hand and wrist course in Lubbock, Texas. I was in Colorado Springs, she was from Boulder. And she was talking about visceral therapy, treating the organs. And she was saying like she'd treat the kidney for knee pain and whatever, and I just thought she was crazy. And she's from Boulder. So if you know anything about Colorado, even the Boulder people will be like, yeah, probably. But I contacted her and I said, hey, we have this wrestler. She's about to have this forever life-changing surgery. Would you take a look at her? So we drove up there. She worked in her abdomen for maybe an hour. I'm just trying to remember my anatomy, to be honest with you. And she's just working in the abdomen. This wrestler had no symptoms for 6 months after one treatment. And I was judging her. I was judging her, right? Even though a lot of what I did was in here too. So, my advice to you is don't let anyone paint you in that corner of what you can and can't do. Let your own practice be your guide. If it doesn't work, jettison it. If it works, investigate it. Go to a course to further that. And that's my last soapbox. So, thanks for humoring me on that.